My name is Dr. Geoffrey Mutuma. I come from the Zambezi Hospital, which is in South Sea, Maimai Road. And I also work in Cambridge as a cancer researcher, and I've been doing cancer research for a long time. And today we want to talk about screening and the importance of screening. What is screening and what's the importance of screening? First thing is that the screening is doing of the test of the patients who are not sick. Screening is actually checking you and confirming that you are okay and you are okay, or you feel okay but you are sick. And that's why normally screening is very important. And mainly screening is screening for the major diseases. And mainly we normally screen for cancers. And when we talk about screening for cancers, we normally check for the cancers which are common in any population. We don't normally look for rare cancers. So when we say that we are screening for cancers, we are looking for the cancers which are very common. Like, let me give an example there, like breast. We know that in every, maybe from 9 to 10 women, one woman will have cancer of the breast. So it means that when we do the screening, it means that most of the women will have cancer of the breast. So when you are checking for cancer of the breast, we know, and our projections that in every 10 women, we can get a lady with cancer of the breast. Cancer of the prostate. We know that every 12 men in Kenya, one man will have cancer of the prostate. So it means that when we start screening and we are checking 12 men in Kenya, we expect one man to have cancer of the prostate. And that's why screening, we screen for the common cancers and also the cancers which are screenable. So which cancers are screenable? The cancers that are screenable is in women is cancer of the breast, cancer of the cervix, cancer of the stomach, cancer of the ovary, cancer of the liver, cancer of the colon. Those are screenable. Those are cancers that are screenable. In men, it's mainly cancer of the prostate, cancer of the liver, cancer of the colon. Those are cancers that are screenable. There are few cancers which are not screenable up to this time. And the cancers which are not screenable is cancer of the brain and cancer of esophagus. Those cancers are not screenable up to this time. We say they are not screenable because there's no, a screening test should be a cheap test which can be done to everybody. And there's a difference between screening and diagnosis. The way I've said, screening is to check you when you're not sick, is to check you when we know this disease or this condition is very common, and then we want to check, do you have that condition, because it's common in the population. And the screening test must be cheap. And that's why something like diagnosis is when you have signs and symptoms and you're coming to see the doctor and you've got signs and symptoms, so you are coming for diagnosis. So there's a difference between screening and diagnosis. So let me start with the screenable disease, and as I start with cancer of the cervix, which we screen by doing pap smear or via Vili. Although personally, I normally recommend a screening test for the cancer of the cervix to be pap smear, not via Vili. But via Vili is better because of availability of via Vili. We know that pap smear is not very easy. It's a bit expensive. It needs a bit of training to be able to report it and get it correct. And that's why we normally say that it's better to look at the cervix even if you're not doing anything. And that's why via Vili is very important. Even looking at the cervix per se by a nurse is normally very important, because if there's something, the nurse will be able to see. And that's why cancer of the screening for cancer of the cervix is very important. And we know is that most of the countries, especially European countries and mainly in US and in Australia, you cannot get a patient with cancer of the cervix. Why? Is because women are done screening every 2 years and every 4 years, depending on the age. And that's why we find that most of the cancer of the cervix has been eradicated in the world just because of screening, just because of the pap smear. And that's why it's very recommendable that most of the women above 18 years, make sure that at least you do pap smear at least every 2 years before 50 years. And between 50 and 75 years, do every 4 years. And after 75 years, if you've been doing pap smear, there's no need of doing pap smear because you cannot get cancer of the cervix at that time. And if you get it will not be a major problem, because remember, cancer of the cervix takes almost 10 years to develop. You have it in the body and it does not develop. By the time you have cancer of the cervix, means that cancer has been with you for a long time. And that's why screening for cancer of the cervix using pap smear is very important. And I do recommend every woman to be done pap smear. Just check to your doctor, go to the nearest health center and ask to be done a pap smear, because pap smear is normally very, very important for all the women, because what is actually quite not good at this time, and especially in Kenya, is that cancer of the cervix is cancer killer number one in women, and all the women who have got cancer of the cervix, they come in stage 4, and that's why screening for cancer of the cervix is very important, and is normally very good to make sure that all the women are done pap smear. And when you're done pap smear, make sure that at least you follow for the report, so that you can be able to know what's happening, because pap smear is very important test or screening test, which has been used in Kenya for a long time. It has been used in Europe for a long time, although pap smear uptake in Kenya is very, very low. And I don't know what the problem is. I don't know is availability. Of course, I know there's reporting cytology is actually not very easy, because it's basically reported by pathologists only. Now, the other cancer is screenable is cancer of the breast. And cancer of the breast screening, we normally recommend self-breast examination, where a lady examines her breast and checks if she has cancer of the breast. And it's normally very important to make sure that at least women know how to do the screening for cancer of the breast, self-breast examination, because all the women who have got cancers, they are the one who actually know that they've got cancer, because they're the one actually who know they've got the cancer, and they are the ones actually who check and find there's a swelling in the breast. So it's very important for women to be able to do self-breast examination, which the procedure is quite straightforward. You check yourself in the mirror and you pipette your breast. And this is done by women. And then the cancers which are now screenable, the most important one is cancer of the cervix by pap smear. Second one, cancer of the breast by self-breast examination. In women, cancer of the stomach, which is cancer number 4 in women, it's very important to make sure that at least you do H. pylori. Most of the people, if you've got epigastric pain, if you have some foods which you don't eat, if you've got heartburns, it's always good to be done H. pylori. When you've got the H. pylori, it's very important to make sure that at least you are treated until H. pylori is cured, because nowadays we've got a lot of problems in treating H. pylori. We treat it and it never gets cured per se because of other factors, and it's always good to make sure that at least you are treated, you are checked, and you are checked to make sure that you are not H. pylori. The other screening test for cancer of the stomach, which is not a screening test, is actually a diagnostic test, because it's expensive, is by doing endoscopy. You scope the patient, you check the ulcer in the stomach, you check if the ulcer is still ulcer, or is ulcer with which are transformed to be malignant. The other cancer which is screenable in women is cancer of the ovary, and this is by doing CA155. That's not screening, it's almost like diagnostic, but we normally recommend that for women it's good to be done CA125 to check for cancer of the ovary, cancer of the pancreas by doing CA199, check cancer of the pancreas, and also CEA, that's a tumor marker, to check cancer of the colon, and also cancer of the colon was very important to do colonoscopy to check, but colonoscopy more of diagnosis because the test is not cheap. When we talk about screening, we talk about cheap tests which can be done. Now, in men, screening for cancers in men is very important to do screening for cancer in men, and the cancer which in men is supposed to be screened is actually cancer of the prostate. Every man about 40 years, about 50 years is good to be done PSA, prostate specific antigens. Normally very important to be done, and we normally recommend for men to make sure that at least you are done specific prostate specific antigen every 2 or 3 years after 50 years. Why? Because cancer of the prostate is very common in men. When you are 70 and above, the frequency will increase because the cancer of the prostate increases like that rate. And we are seeing so many men, all men with cancer of the prostate come stage 4. Of course, one thing which is very good is that cancer of the prostate is treatable and curable irrespective of the stage. And I think most of the other videos in this YouTube, I've said that several times. Cancer is treatable and curable in its stage. So cancer of the prostate screening is actually by doing PSA in men. And PSA in men, we just do it very simply, is that removes very small blood in the finger, the way you do the malaria or the blood sugar, and you find that when you do that, within 5 minutes, we do is positive or negative. If it's positive, you go ahead and do the long test called PSA levels to see how high it is, because if it's about 4 nanogram per liter, it means that that patient has got a high chance of having cancer of the prostate, which in most cases, as I've said, cancer has no symptoms and no sign and still is in stage 4. And that's why screening for cancers is very important, because you don't have pain, You don't have any signs, you don't have any symptoms until the cancer has gone very far. The cancer damage your body is when you come to stage 4. And that's why up to this time, the 90% of our patients, they come to the hospital when the cancer is stage 4. It means that all the patients in Kenya, and this is very important, that all the patients in Kenya, they're coming stage 4. And that's why we need to do about screening. And that's why us as the hospital, normally what we focus is accurate screening and awareness of cancer, because that's what saves life. That's what make ourselves to know that got cancer as early enough. Of course, and their cancers are not screenable. They have said cancer of the brain, cancer of esophagus, not screenable at this time. And we need to know. Now, the other cancer which is screenable in men is cancer of the liver by doing alpha fetoprotein, cancer of the pancreas, I've talked about that, and cancer of the colon by doing cord blood or by doing colonoscopy, which actually colonoscopy is a diagnostic test. So most of the cancer is screened. So screening is very important, and that's why what is very important and what we need to save our lives or to save most of the people is not by doing the diagnosis, which is very important. It's not by doing treatment, which is also important, or even research. The most important thing to be able to control, prevent cancer, and be able to save a lot of lives because of cancer is by awareness. Awareness is very important, and also screening is very important. Those are the two main components which we need to tackle cancer at this time. And once we tackle cancer at this time, and the most important to tackle the cancer is one, by individual level, at the community level, and also in government level. And what's very important is that awareness is very important, and screening is very important. We need to focus on that. Now, to emphasize a bit on awareness, it is very important as a hospital, because we normally have this breast cancer work, which we have been having it for quite a long time, just to create awareness. We are doing the work just to create awareness. We do the works, mainly we do the works in February, and this year we are doing the works also in October, because there are some counties which have requested we do the works in October, although as we want to focus on doing our works only in February, which is Cancer Awareness Month. And our work in February, we would normally do it in Mombasa, we do it in Machakos County, we do it in Nairobi County and Kiambu County, that's in Thika. And then we normally do the last Saturday of February. That is the next year we're doing on 24th of Saturday, and we'll have the works in all those places. But this year, which is a second cancer walk, and this year we do it in Meru, and we do it in Meru. We'll do it on 30th of September this year. We also do our cancer walk in Makueni on 7th of October this year, and we also do a cancer in Kwale on 14th of October this year. So it's very important for all of us. Please let us join us this year to be able to join us. For those who come from Meru, for those who come from Machakos, for those who come from Kwale, join us with our cancer work. What you need to just buy a t-shirt, come, and that day we'll be able to do the screening, the way I've said, and be able to do the screening of cancers we have talked about today. And basically, for those who will be able to join us, buy a t-shirt, we'll screen cancer of the cervix for women and cancer of the prostate for men. That day will not be charging, provide you for the t-shirt. You need to do it on that day of the work, and that actually makes a big difference as far as the screening and also assisting the people who have got cancer. Remember, the cancer works, and whenever we do the cancer, whatever we do in the cancer works to create awareness, do the screening, we normally assist so many people for awareness. Mainly, most of our inputs and most of our funds in cancer works, they go to awareness, and other funds, they go to screening, and there's a bit which goes for treatment for those who cannot be able to avoid the treatment of cancer, because we don't want any patient who comes to us to be able to lose chances of finishing the chemotherapy or radiotherapy because of lack of money. We know cancer is not very cheap, it's very expensive. It turns families into beggars, and that's why we normally try to assist where we can. Of course, us as the hospital, even myself and Dr. Mutuma, there's nothing much I can do, but the little I can do, I appreciate that, and appreciate all the sponsors, all the people who have actually funded me, all the people who have joined me for the cancer for the last now 9 years now. It's normally very important to make sure that at least we join us and we see what we can do with cancer. And that's why this video and this YouTube has been running, and most of the times we talk about cancer. Of course, we're talking about other diseases, and normally very important. So thank you very much. For my number, if you want to call me, if you want to get in touch with me, is 0722-801-299. That is the number for Safaricom, and Airtel is 0734-801-299. Thank you very much.